Hi, I'm Dr. Konys. Some of you may know me as the devoted husband and subservient houseboy to my lovely wife, Karen. Others may recognize me around town as Dad to Janet, Jack, Hallie, Casey, and Sawyer. Oh, and these guys, they taught me everything I know. Come on in. If you're watching this video, chances are good somebody sent you in to talk about your wisdom teeth. Usually it's your dentist or your orthodontist. What's this? This is awesome. This is the best thing. I've been looking for this. Take it to room 1. I'm using it on Mr. Northrup. His teeth always give me problems. Thank you. And some of you may be here because your parents thought it'd be a funny and cruel welcome home from college joke. And others of you came in just because your teeth plain hurt. Regardless of how you ended up in our office, you came to the right place. You see, I just call it like it is. If your wisdom teeth need to come out, I'll tell you. If they don't, I'll tell you that too. My job is simply just to educate you on the options, indications, and complications of wisdom tooth surgery. That way you can make a well-informed decision on what you want to do with your teeth. By doing that, I sleep well at night. There are basically 4 indications for removing your wisdom teeth. The first one, bring in the graphics. Number 1 is infection and decay. If the teeth are broken down, it doesn't make any sense to try to save them. We generally recommend that you remove them. The second indication is pathology, stuff like cysts, tumors, things like that. We usually don't see those around wisdom teeth, but if they're present, we'll probably recommend that you get your teeth removed. The third indication are teeth that have the potential for developing periodontal problems. This is especially important around the adjacent teeth. The fourth and most common indication are teeth that are only partially erupted. They have no chance of erupting in a normal functioning position, and this is the most common indication for removal that we see. If you leave these teeth long enough, they will become infected and decayed, and you'll only have to come back later to get them out. So you might as well do them now. Oh, everything else is elective, and contrary to popular belief, not every wisdom tooth needs to come out. In fact, I still have 3 in this thick skull of mine. Oh, and another thing. I'm going to let you in on a little secret. Wisdom teeth don't cause crowding, and they don't cause headaches. There's tons of studies that show this. So if you get them out, I doubt your teeth are going to get straighter, and I doubt your headaches are going to go away.
So if I fall into one of the 4 categories, what can I expect from the surgery?
First of all, every tooth is different, and everybody responds differently to the surgery. Some people bounce back right away, and other people take longer. One thing I tell everybody, though, is don't listen to your friends' stories about their wisdom teeth. Chances are they didn't come here, and I can guarantee you that their experience was not as bad as they said it was. You know, I've heard just about every war story there is about wisdom teeth. But let me tell you something. I've never seen anybody have to put their foot on top of somebody to get their wisdom tooth out. I've also never seen anybody climb on top of the patient to get the wisdom tooth out. I've never seen roots wrapped around the jawbone, and I've never seen anybody have to break the jaw to get the wisdom tooth out. What I have seen will turn your stomach. I've seen teeth fly out of the patient's mouth into the surgeon's mouth. Twice. Ooh. I know. I was that surgeon, and I can still taste those teeth. The potential complication of wisdom tooth surgery is actually pretty straightforward. Let's go to an x-ray and see what I mean. Up here we see an impacted upper wisdom tooth. The important structures to take into consideration when we're talking about upper wisdom teeth is the sinus. The sinus is important because the roots of the wisdom teeth always stick up into the sinus. Because of that relationship, some people get sinus problems when they get their wisdom teeth out. But that doesn't happen very often. Now, when we talk about the lower wisdom teeth, we want to know about the position of the nerve that runs down through the jawbone here. That nerve is important because the roots of the wisdom teeth always lie in close proximity to it. Because of this closeness, Some people get numbness in their lip after their wisdom teeth are taken out. Usually that numbness is temporary, but it can be permanent. I've never seen that happen, however. One thing I guarantee will happen involves the joints. Your joints are going to be sore after the surgery for about a week or two, but that usually gets better on its own. Those of you who already have joint problems are going to be especially affected by this. As far as anesthesia is concerned, there's one thing I want you to know. I'm not going to hurt you when I do your wisdom teeth. In fact, I hate the dentist. I want you to be treated the way I want to be treated when I'm in the dental chair. Having said that, we have 3 options for you to choose from. A lot of people like to have their surgery done with local anesthesia. If that's you, then we've got TV, movies, and virtual reality glasses to make your visit more enjoyable. Whoa! Did you see that? Some people are too nervous having the procedures done with local anesthesia. If that's the case, then we have nitrous oxide to breathe through your nose. It won't put you to sleep, and you won't be sedated. But you're not going to care that you're here. Some people prefer not to remember being here for their surgery. If this is you, we can give you nitrous oxide to breathe through your nose and some martinis through your arms so that you don't care where you are, you don't remember being here, but you can still breathe and cough and talk. If you're nervous, choose this option. What the heck, you might as well have fun while you're here. After your surgery, we'll give you prescriptions and written instructions for what you can and cannot do. We'll also give you some hints on how to make your post-operative course easier. Hope this video helps you understand wisdom teeth a little better. I'll be in a few minutes to go over your x-ray with you. If you have any questions, please feel free to ask anybody in the office. I really want to thank you for letting me be a part of your dental treatment. Sit back, relax, and I'll be in a few minutes. Don't move.